The anterior talofibular ligament, or ATFL, is a part of a group of three ligaments called the lateral collateral ligament of the ankle. The lateral collateral ligament consists of the ATFL, as well as the calcaneofibular ligament, or CFL, and the posterior talofibular ligament, or PTFL. 80% of all ankle sprains occur to either three of these ligaments on the lateral side, with the other 20% of sprains occurring to the deltoid ligament on the medial side. The ATFL has an origin at the distal end of the fibula and an insertion at the lateral side of the calcaneus. The ATFL sprain is caused by an inversion of the ankle joint, where the foot rolls in, so the sole of the foot faces the other foot. The inversion places stress on the lateral collateral ligaments, which causes a tear in them if the stress is too great. Inversion can be caused by a number of factors. A study from G.D. Mackay found that 45% of ankle sprains in basketball from a player coming down from a jump and landing awkwardly on the surface or on another player's foot. The study also found that 30% of ankle sprains were as a result of sharp twists or turns. These are also the two main reasons for ankle sprains in all sports, not just basketball. The sports where lateral ankle sprains are most frequent are sports where athletes have to make these movements often. Sports such as basketball, netball, rugby league, rugby union, AFL, NFL, and soccer. A grade 3 ATFL tear carries a host of physiological effects around the side of the ankle. The ligament has over 80% fiber disruption and generally means the ligament has snapped in two. This causes high joint instability and poor balance. The ligament will also stretch to over 10% of the initial length. It carries severe initial pain, but often the pain dies down reasonably quick, which means the athlete can walk away with only discomfort. However, the ankle will not tolerate heavy loads. The athlete will experience severe swelling and cannot continue activity, or the athlete may face a longer recovery time. With a complete tear in the ATFL, a tear in the calcaneofibular ligament is likely. A third tear in the posterior talofibular ligament is also possible, and if all three occur simultaneously, it can cause a dislocation of the ankle. As well as all that, cartilage can even be torn off the bone in severe cases. If an athlete or anyone suffers from a lateral ankle sprain, immediate treatment is essential, especially if the sprain resembles a grade 2 or 3. The Ricer method should be immediately administered. Rest. The athlete should immediately cease activity, be placed in a comfortable position with the ankle elevated and supported, and attempt to keep off the injured ankle until a careful mobilization method is put in place. This attempts to prevent swelling and/or bleeding, as well as prevent further injury to the ankle region. Ice. The ankle should be either placed in a bucket of ice, wrapped in a wet towel with crushed ice inside of it, or have a frozen gel pack with an insulator applied to it. This process should happen for 20 minutes every 1 to 2 hours for the first 2 to 4 days after the injury occurs. This attempts to reduce mainly pain and blood flow, which in turn decreases swelling. Compression. An elastic bandage should be firmly wrapped around the ankle. The bandage should reach and cover most of the foot as well as reach up half the calf muscle. This ensures that the whole region is compressed. The bandage should be applied at the time of the injury and be reapplied periodically for at least 24 hours. This attempts to decrease bleeding and reduce swelling by decreasing blood flow to the site. Elevation. The ankle should be elevated so it is raised superior to the heart in relation to the ground by placing a support under the foot. The athlete should be placed in this position whenever possible during the day, as well as throughout the night for the following 48 to 72 hours after the injury occurs. This attempts to decrease bleeding and reduce blood flow to the ankle, which then in turn reduces swelling and throbbing. Referral. As soon as possible after the injury, a doctor or physiotherapist should be contacted for medical advice. An appointment should be made to find the extent of the injury, which is needed to administer the correct rehabilitation method for the sprain. For a grade 3 tear of the ATFL, surgery is required to repair the damaged ligament. The surgery reattaches the ligament, and some of it may have to be taken out to counteract the stretching. The rehabilitation for the surgery is long, 6 to 12 months. The first phase of the rehabilitation consists of a cast being administered, covering from the metatarsals to the halfway up the gastrocnemius. The cast is left on for 1 to 2 weeks, ensuring that the ankle supports no weight during that time. After that period, the cast is removed and replaced with an air cast, or moon boot. At this stage, weight bearance can be gradually applied to the ankle, while ensuring no pain is felt during the process. The boot stays on for approximately 4 weeks. There are a range of rehabilitation exercises that your doctor or physiotherapist will recommend to help the ligaments repair themselves. This list, sourced from McKesson Health Solutions 2001, outlines some of the main ones that help the ankle the most. The exercises range from static stretches to motion exercises, balancing exercises, as well as resistant exercises and jump roping. These exercises help to strengthen the ankle as a whole. However, your doctor may have you only do specific exercises at certain times during rehabilitation. There is no one correct way of doing it, as each situation is unique. This is a segment of a video from In Touch Osteopathy on YouTube detailing how to properly tape a laterally sprained ankle. A link to the full unedited video as well as a step-by-step description can be found in the booklet. First, she applied the anchor and now the stirrups. Now she is applying the figure of sixes. Now for the heel lock. And finally, the ankle lock. Thank you for watching. Please refer to the booklet for a more detailed overall description of an ATFL tear.